Diabetes. The symptom, the disease, the purpose. Imagine, folks, unfortunately these days social media is full of this. People who are neither doctors nor nutritionists, and they have no information, certificates, or studies at all about diseases. And they talk about patients with chronic diseases in general, and diabetes in particular. And they deny the existence of these diseases. These diseases do exist, folks, and they've been documented in medicine since the Middle Ages, since the days of Ibn Sina and all that. The whole point is that throughout all this time, two things have been developing: the way, or the understanding of how these diseases occur, so that we can deal with them. And the other thing is the attempt to invent medications to control the causes we discovered for these diseases. You'll be surprised to know that there are people who deny the existence of these diseases. And honestly, we've talked to our dear patients more than once, whether directly in our clinic or through social media, and we told them that God Almighty and religion has said, "Ask the people of knowledge if you do not know." And what is meant by the people of knowledge are the specialists. I'm a doctor, that's my field. I can't interfere in engineering or things I don't know about. And then, it's not just that I stay in my lane. No, I go as far as to say that those engineers are biased and what they're saying is wrong, and I start misleading people. Believe me. And this is a message I'm directing to the people who talk about these things. And unfortunately, I say this with complete frankness. I don't know what your intention is. But believe me, if there's a patient who suffers complications or dies because of the nonsense you're saying, that patient will be your responsibility on Judgment Day, and God Almighty will hold you accountable for it. As a doctor, for example, if my specialty is internal medicine, I don't give opinions about orthopedics. I don't give opinions about surgery. I don't give opinions about obstetrics and gynecology. Yes, I have information, and a lot of it, and I could talk about a lot of things. But when someone asks me about a specialty outside my field, I tell them to consult the experts, guys. Why? For two reasons. First, the studies we did back in medical school were just basic studies about those specialties. The second thing is that there might be new developments now in every specialty, and each person is up to date in their own field. They know what developments are happening, whether it's new medications, what they call guidelines, or as we mentioned before, even the way diseases occur. So, everyone really needs to stick to their own specialty, please. It's not about competition. It's not about fame. It's not about just talking a lot for the sake of it. The point is, when you share information, you have to be responsible for it. For example, when I talk about nutrition or elements related to our diseases, I only speak within the limits of what I've personally tried myself. That's it. I'm not a substitute for a nutrition specialist. You'll find in my recommendations. And in the comments, I always say you have to consult a nutrition specialist. Guys, they know more about this stuff than we do. When people ask me, "Doctor, can you give us ready-made meal plans for diabetics?" I tell them, "No, guys, that's the nutritionist's specialty. Go to them. They'll give you those things better than we can. But what we talk to you about is how diseases happen, about treatments, about those things." And every day, there's something new with these diseases. All right. When there's something new and proven, that's what we talk about. There are a lot of things still under research that we don't even mention. I don't bring them up until they actually happen, get approved, and their results start to show. Even when a new medication comes out on the market, that's it. And despite all the advertising that pharmaceutical companies and others do, I tell people, guys, this is a new drug that's only been on the market for a few years. We still don't know all its properties. Some side effects might only show up later. Don't rush to take it or believe the pharmaceutical companies right away. This isn't out of spite toward pharmaceutical companies, but out of concern for the patient. So don't let someone come and tell you, guys, there's no such thing as diabetes. They'll say, diabetes is just a symptom, and I don't even know what it's a symptom of. And if you do 1, 2, 3, you'll be completely cured of diabetes. I wish that were true, honestly. But honestly, guys, and this is the last time I'll say it, if any patient gets harmed because of you and your words, you will be held responsible for it on Judgment Day. God, I have delivered the message. Oh God, grant healing.